Let's move on to slide 27. So MIPS reporting, what do you need to know? On slide 28, there are two main options of how you can participate. The first is as an individual, so on your own, which is based off of your unique NPI and your unique tax identification number. And then the second option would be as part of a group, which is where 2 or more clinicians have reassigned their billing rights over to a TIN. One piece to note, if you decide to participate as a group, you would, or as an individual, you would do so consistently across the entire MIPS program. So if you decide you want to do quality and improvement activities, and you want to do quality as an individual, you would need to do improvement activities as an individual. The other piece I'll note for group reporting, just because you are part of a medical practice with more than 2 clinicians, it does not mean that you have to participate as a group. It's an option available to you. So there could be a 10-person practice and everyone participates individually. That's completely fine. These are all just choices available to you. So let's move on to slide 29 for the submission methods. And what do you need to know? So submission methods means how can you actually participate? How can you get your data into us? So on slide 30, there's a chart here that lists out the options that are available. You'll note across the 3 categories, there's 3 that are consistent across both individual and group reporting. That includes qualified clinical data registries, qualified registries, and electronic health records. We also have other options available. So let's move on to slide 31. If you do decide to participate as a group, you would need to register by no later than June 30th of this year, only in the instances where you decide to report using the web interface, or if you elect the CAHPS for MIPS survey. In all other instances, you can just simply work with your registry, your QCDR, or your EHR, and they will submit your data to us on your behalf. This is a change from how things previously worked under the PQRS or VM program. The feedback we received is that requiring registration across the board was unduly burdensome, and that's not what we intended to do. So let's move on to slide 32. So here's just some helpful information on some of the submission methods. I won't go through this, but I would suggest to folks that they take a look at this later on.